But all you need to do, open it up, and
Все, що треба, відкривайте.
everything you need will be right here.
Все, що там.
We kind of spread it out a little bit more over there, but I'll show you guys mine because mine's a little bit more detailed.
Детальніше.
And we'll go over how to use everything and what you need to have in your IFAC kit. And if it's possible for when you guys leave this course to, go home and try and find the necessary supplies needed so that you can have your own IFAC kit as well. Because you never know what kind of situation you can be in. Throw it in your backpack or your purse or wherever. They tend to be pretty small.
Якщо ви розумієте, так, бо я бачу, що махаєте головами, так що навіть якщо ви щось не маєте, ви можете вдома пошукати щось собі приготувати для себе. Теж схоже те, що ви маєте, що ви бачите тут в базовому.
So the first thing, every single one of them, you need a pair of gloves.
Пара рукавиць, найперше.
So this is what's called Israeli bandage or a compression bandage. It's so you can get it really tight around a wound and apply pressure. So I like to run, these are what's called chest seals, 2 chest seals.
Це є грудні наклейки, так сказати.
Because with every single, especially with bullet wounds, we'll go into it. This is just to show you what you kind of want your kit to
Наразі
look like.
показуємо, що є в наявності, що саме.
But to really simplify it, it's to seal a chest wound. So if a hole is made
Якщо
in your
рана є на
chest,
грудях, значить ви її можете закрити.
it's so the air doesn't get seeped in, if that makes sense. You want 2 for the front and the back, because with every single hole,
Так, якщо є це.
entry and exit wound. You want what's called combat gauze. So this might
Це
be.
є марля, військова марля.
This is for wound packing. So if you get hit in what's called a junction area, it's so that you can fill it to stop the bleeding. Basically to pack it really tight, which will put pressure on an artery.
Значить, ви цим спиняєте кровотечу, артеріальну кровотечу. There is a number just to put everything on the table. For more convenience.
Okay, yeah.
Okay. Yeah, they will see clearly. Yeah, it's all right. Look over there.
Let's use the basic.
Do you know any of these vocabularies in Ukrainian?
Not really, man. So these 2 things basically is this together, but I just carry extra just in case.
Це він просто оці основні, оці екстра додаткові.
And I personally, and then an emergency blanket, and this is to keep warm.
А це є ковдра, так, щоб в теплі тримати.
And then I just keep some extra 4x4 dressing.
А це для трошки запасу для.
And you'll need this either to clean up, or like to clean blood off the person, or to
щоб
just put pressure.
повитирати кров, щоб для перев'язки.
And this is just a basic kit.
Це базовий.
This is just for, the bare minimum. In terms of more medical supplies, we would usually keep it, in a different bag as a medic. But this is what every soldier should have on them.
Це те, що слід кожному солдату мати зі собою. Все, що більше є в додатковій валізі.
Okay. So, in terms of our course, we went through our IFAC, the basic equipment. So again, I want to repeat it. Use the soldier's IFAC. Don't use yours.
Так, ще раз наголошую, використовувати те, що має солдат зі собою, те, що військовий має на собі.
Він використовується тільки для себе. Тобто він не використовується для інших, він використовується в першу чергу для себе, а все, що є в рюкзаку, вже можна використовувати для інших людей. Тому таке маленьке.
Так, для себе, але коли йдете, наголошує лікар, коли йде лікар, парамедик іде, він не користується своїми, а він користується тим, що є солдата.
Okay, so one of the first things you'll do in a situation that is dangerous or a combat situation is make sure the scene is safe. Many people respond to seeing other people injured and having medical knowledge. They want to rush to the casualty and help.
Є на полі бою, в районі бою, що ви маєте запевнитися, що є безпечно, тому що природній чинник те, що ви зразу поспішаєте на допомогу.
You have to make sure the scene is safe
Ви
because
повинні подивитися,
if
чи
you go
безпечно.
into a situation that's dangerous and you are injured, you cannot help a casualty.
Якщо будете поранені, то ви не зможете допомогти.
So you're no good to anybody if you're dead.
Ви знаєте, що нема що допомагати, нема, коли ви загинули, так, не допоможете.
If you are in a combat environment and say you are a soldier or you are defending yourself, the best thing you can do is eliminate the threat by either shooting back or evade the threat by running away or like hiding, taking cover immediately
And wait until it's safe.
and wait until it's safe.
Угу. Тобто як забезпечитись? Ну, тобто ви чекаєте, коли чи є небезпека, ви уникаєте цієї небезпеки, чи якщо можете захиститися, захищаєтеся, або просто втікаєте від небезпеки.
Okay. Do you want to go over casualty movements now?
Yeah.
Okay.
Yeah.
So now we are going to go over some effective ways to move a casualty out of a danger site. Once the site has been cleared, you want to move the casualty away from that site so that there's no more danger. War and combat, it always changes. So you never know if the enemy that has hurt them, even if they've been defeated or pushed back, will return. So take that casualty and move them, and we will show you techniques on how to do that.
Так. Зараз ми покажемо вам, як забирати пораненого з поля бою, але найперше ви повинні пересвідчитися, що насправді є безпечна сцена, безпечне місце.
So if a soldier's wearing a flak vest like this, most of them
Let's
should-
clear back. Can we push back? We're going to need some room to show, to
Yes.
demonstrate
Yeah.
the techniques.
Ви можете піднятися саме спокійно.
Oh yeah, here.
Of course. That makes sense. Thank you.
So every soldier should have like a pull handle on the back. So
Ось кожен солдат слід кожному мати отаке таку
Grab here.
штучку, з якою ви можете потягнути його кожного є.
Drag.
in the same way, if you have rope,
І також маєте шнур.
You want to do the arm loop?
yeah. So you can just run it around my arms.
Okay.
So also there's
Rope just in a loop like this.
Робите петлю ось так і
Gonna lift your casualty up.
ага, трошки піднімаєте пораненого, попід руки, робите такі. Ви всі бачите, як ви робите. Так, і
You're not coming up.
ah,
That's fine.
that's not how you're supposed to do it. But here,
We're doing a figuration.
just throw it under here.
I'll be the example.
ще раз, ще раз.
Just run it around like that and pull.
Double loop. Get here.
Ага.
Two hands, and also multiple people can carry. So get up your cam.
Два кінці кілька людей можуть нести.
He picks up my legs.
It was too long
Twice.
first time. It was
It
too
wasn't
long.
too long.
The knots
Yeah.
broke. I think it was.
Yeah.
Yeah.
And grab this
It
one over here
wasn't,
on my left.
it wasn't
I
strong enough.
No, no, no,
Воно не
grab
було
this
досить
Ah.
сильно тонкий
So,
шнур.
okay.
Тобто ви
Two
перевіряєте,
people
що
can carry
ви
back,
робите.
and it's easier and faster.
Yes.
So if we're evacuating, two people can carry. Much better.
There's different ways you can do it.
Різноманітні способи, що ви можете це зробити, одним словом, що шнур використовується.
Yeah. The important thing is just to have some rope and just
Так, просто мати шнур зі собою, і ви можете використовувати. Єдине, що
yeah, and be able to tie any knot. It doesn't matter what kind. Just get it around him, especially around the arms. And you can just tie it.
будь-що попід,
Alright, let's do fireman carry.
навіть якщо шнура немає.
Yeah, I'll do this.
Okay.
So I'm gonna lay down.
А можете ще спитатися, якщо немає ні шнура, ні цього ручки, якщо береться просто за комір, чи його воєнна форма дусить чи не дусить?
Не дуже. Не дуже. До такої ситуації, if it's not tight around it,
Якщо воно не є дуже тісне, то воно не дуже
Ну, бо немає ручки, немає шнурка. Взяв
Yeah, the
за
question
комір і
is if
потягнув.
he can pull for,
so the way
just dragging
Oh,
for the
just the-
collar. Yeah, just using the collar.
the collar might not be strong enough.
Yeah.
Ну, в
Yeah,
такому
якщо
такій
комір-
формі, як вас
якщо
є,
комір
вас
дуже
задусить
сильно-
оце, якщо я
Uniform,
підтягну,
well, you
вас же
piece up.
згортає
Каже, що
перекриє.
недостатньо сильний
you-
комірець
you
може
can use a
бути.
uniform to drag as well.
Yes.
Краще
Так.
тягнути за лямки.
Можна використовувати.
Ну,
If
якщо
it's,
так, це
if it
якщо вони
isn't too
є.
tight, yeah, if it's
So here's how we
dangerous
look
one.
at it.
Yes.
If you're dragging somebody out, it's because you're dragging them because bullets are flying, right? So if bullets are flying, it's okay to choke them for 30 seconds, just so you can get them out of the way.
Гаразд, можна кілька секунд там, щоб він трошечки потиснути тут
Якщо
горло,
немає
але
обстрілу,
тому що
можна
час.
Бойових
розщепити
діях,
і
бойових
Час,
діях, коли
тягти.
повністю сидять, нема
час,
часу,
важливий
то
час. І важливий час, що кілька секунд пояснює, що кілька секунд можете його трошки по...
Okay, so now we'll show you a way. It's called a fireman's carry. It's a very easy way to pick up somebody, even if they weigh much more than you.
Якщо
And it,
так
it
як
allows
пожежники
you
носять.
to show them and go around. Wash my arm because I got that cut. Grab my wrist there.
Then you sure you want someone else?
Інший спосіб перенесення пожежних.
Wait, okay, don't freak out this time. Just relax. Make a good job.
Так, руку, так.
Так, ось так.
І все.
Ага.
You gotta roll it.
Yeah, there you go.
Ти можеш нести.
Well done.
And it's not too heavy.
Якщо не дуже важка ноша.
Or even, you can even grab his hands, grab him by the hands, just drag
Ага,
him.
можна навіть за руки, ну, дивлячись по ситуації.
Another benefit to the carry like this, the fireman's carry, is once you have your casualty on your shoulder, you have the ability to still use one arm. I'll show you how to do that.
Ага, перевага те, що ви використовуєте одну руку. Просто одною рукою тільки, так. О. А друга вільно можна ще щось робити. Це перевага такого способу пожежі.
So you can manipulate things if you have to have a weapon in your hand,
Так,
then
якщо
that's
є
the way to do
зброя,
it. And if not, here I'm going to show them. This is a second type of carry. This is, I don't know the name for it, but it's just, I call it an extended arm carry. For someone that's much
на
bigger than you,
витягнутій
because
руці,
as you can see, he's very strong, he's much bigger than me, so I should have trouble picking him up. It's much easier to turn
я
aside
менший від нього, але
like this.
інший
You can
спосіб.
get them up, you grab both of their arms, extended and locked, lean them over your back,
Ага.
and then
Називаю його коловий, тобто коло, ну так, коли ви півколом вперед. На себе накидаєте. Навіть якщо більша важча ноша, то таким чином можна.
yeah, let's do like that's pretty easy, buddy.
But it's convenient when he stands, yeah?
Yes,
But
But-
when he is laying down, how you can put him on
let's
yourself?
go over that.
Yeah.
So what we were showing examples of was just the standing. We can go into being able to pick up a casualty from a laying position. Yeah, that sounds good.
А що казав, що
Okay.
вони
All
експеримент?
right, lay down.
Питалися, якщо лежить, я перепрошую, якщо лежить і як можна
Yeah, pretty much.
Як підняти, якщо
так
лежить?
підняти і
So
Оце носіння
when
було
you have
зручне, коли
casualty,
стоїть.
what you can do is you'll pick them up,
піднімаєте,
you'll sit them up into a seated position like this. You're going to utilize your knee to support their back.
підтримуєте
And then
коліном
once you get
спину,
them to this point, hold on to the back of their carrier,
плястик і
and then you can manipulate them out of this form from here, from this one.
Можете
So it takes
спереду.
more effort, but if your casualty is conscious, they can help you.
Більше зусиль, але якщо свідомість є, свідомості людина,
So you'll come here, you're going to help your casualty up
можете таким чином підняти. Більше зусиль ви
from
прикладаєте,
that
але
position, and if you have someone else to help, you can do
може
that on
хтось
the other side
допомогти
as well.
теж.
And then,
І тоді пожежник
same thing, just like
цей
that.
спосіб.
Thank you.
Good, of
Дякую.
course, yeah.
So,
That's all. That's all.
so the important thing to remember is if people are shooting at you, do not go running to the person.
Якщо
to go
люди у
out.
вас стріляють, найважливіше, якщо у вас стріляють, то не біжіть. Не біжіть.
The first and most important thing is to be safe yourself. And
Забезпечте себе, тримати. Найважливіше це те, що ви в безпеці.
you're gonna,
Тоді ви можете
if
допомогти.
you guys have weapons, fire back at the enemy, and
Можете стріляти в ворога.
you get a secure perimeter around, then that's when you want to.
Забезпечте себе.
That's when you want to take the victim, whoever's injured, take them and then drag them to somewhere that's
Можете
safe.
тоді жертву брати і тягнути в безпечне місце.
Okay, so that's gonna bring us to.
А спитайтеся, чи можна буде попробувати, чи я би підняв би.
О, if he can try,
Yeah,
ask.
Я просто
Куля, так, пробуйте.
What's he want to do?
Pick me up. He wants to see if it's practical.
Oh, to pick you up. Okay. Try with someone lighter, I would say.
з горизонтально.
No? Okay. Да.
Коліно,
Коліно
коліно.
підтримуєте, коліно підтримуєте,
Навпаки.
коліно підтримуєте. Коліно.
О.
О, так. І тепер
Pull around.
There you go.
на руку піднімайте потихеньку. Трошки вперед, так.
Hold on here and move your leg.
Тримайте ззаду за хлястик, піднімайте, за хлястик піднімайте, так. І так. І тепер на себе. На себе, так. Під ногу. Так,
Така су праву, да?
так.
Да.
Так, так, так.
Ну і можна
Є!
Тікайте.
Give him a gun.
Саме важче було підняти з землі. Ну якщо при пам'яті, то допоможе.
Ви таке.
So tourniquets, right?
So yeah, well, we're gonna go into assessment next.
Tourniquets.
You want us to tourniquet?
Because tourniquet is the one thing you can do.
Yeah, let's do it.
So
Oh yeah, that's right.
I'll show you guys up here because
Show them both. That's right.
yeah, but we'll show them first this.
Yeah.
So
Це
this is probably the most important thing that you can have on you.
найважливіша річ, напевно,
And this is what's called a tourniquet.
турнікет.
I think most people by now know what it is and
Так,
what it
більшість
does.
знає, що це таке, правда.
But to make it very simple, if someone is bleeding out,
І хтось кровоточить,
this tightens down around either the leg or the arms
то в'язуєте це довкола ноги, руки,
to stop the bleeding. Basically,
щоб припинити кровотечу.
it basically puts up enough pressure to stop the artery from being able to pump blood.
Воно притискає просто.
This is the one thing that you're allowed to do under fire or in a dangerous situation, because this can really save someone's life.
Це
And
може
it
врятувати
takes 15 seconds to put it on.
життя.
Єдина річ, яка
15
дозволена
секунд,
під
так?
вогнем,
Це
оце
річ,
зробити.
Так, яка дозволяється при відкритому вогні. Те, що ви можете зробити, коли небезпека.
Але зараз, оскільки є праця з волонтерами, і дуже багато є підробок насправді, і ми
There are many fake
бачимо
tourniquets.
неймовірно багато відео, де люди просто перевіряють і просто виказується підробка, яка ламається, тобто сама ця паличка, вона ламається, не закручується до кінця, тому треба обов'язково перед тим, як відправляти, якщо ви волонтерите, або перед тим, як самому використовувати, потрібно перевіряти і тестувати, тому що коли буде вже потрібно, воно може просто в будь-який момент зламатися.
So, what is the way of checking the reality of genuinity of the tourniquet? Because there are many fake things, many tourniquets,
So,
and she has seen many videos
In the U.S., there's a lot of
in actual
organizations
situation.
that kind of do that check and make sure that everything is to the right standard.
So should we check before?
Yeah.
That,
You want to check
yes.
to see here if it has the name. It's CAT,
Ага.
which is
Тобто
CAT.
дивіться спочатку,
Tourniquet.
як перевірити. Ось бачите, що всередині є назва.
Кет, пише назва кет.
Їх немає.
Yeah, I know. These are.
We'll teach we'll teach a few ways.
Оці надійні.
Ми зараз навчимо вас кілька способів.
So this is an American tourniquet.
Це
If
американський
it's American
турнікет.
made and it says CAT on it, you can see that it has numbers as
Так, там
well.
є цифри, все. Тобто ви можете таким чином
It
перевіряти.
also will usually have an expiration date. So
Має дату термін дії.
but being able to tell if a tourniquet is legitimate, it would be hard. You would have to, we will let you inspect these tourniquets so you can see what the stitching looks like and feel the strength. And if it feels and seems like that and the fabric is the same and it's the same material, then it's
Так,
probably a
тобто
good tourniquet.
оригінальний ви все можете перевірити, як тканина відчувається, як воно притискається, як воно склеюється.
Yeah, I'm not sure about medical supply here in Ukraine and in Lviv specifically, so that's a hard question to answer about.
Так, важко відповісти на це запитання, бо вони не знають, як ми не знаємо, як яке наскільки тут постачання. There are few.
Yeah,
Few
that's
things
I
like
kind of
this.
assumed that.
Yeah.
Okay.
Вони припускають, що так є, як ви кажете. Так.
We might be able to give you guys some. We'll see if we have any extras, and then we'll be able to hand out a few because a few is better than nothing. So
Так, вони роздадуть краще кілька мати, ніж нічого.
so with the tourniquet, what you want to do is you want to open it up completely
Ви відкриваєте його,
if it's packaged. What you have here is this band,
це
and then you're gonna run it through the loop,
ви його в петлю запихаєте, так, цей
and
ремінь.
then once you get it on, you'll spin it. So most of them should be already set up. Like when you get to them, if they're on a soldier, they should be already set up. So the way they'll be set up is usually it's like this.
Тобто ви вбиваєте
Вона вже вдіта в
Yeah, I
петлю.
don't know if it gets like that.
петлю і
Yeah, so it should look like this. So when you get it, all you have to do is grab it, pop it open.
так.
And then
Воно
from
вже
there,
початково,
it's a-
оригінально воно вже є за, I'm sorry, I just explained
Yeah.
for the rest.
Yeah.
Because some of the people can understand, but others then are
You see,
asking questions.
So-
Воно вже готове перед тим, воно вже запаковано, тобто вже запхане в петлю. Єдине, що вам треба тільки розтиснути його так, роз'єднати і далі
so
затиснути на
tourniquets are only going to be used in 4 places. So
в 4 місцях може
your
бути.
arms and your legs.
Руки, ноги.
And a lot of doctors say 2 to 3 inches above the wound.
3-4 інчі, то
Дюйми.
кілька сантиметрів, так, там де сантиметрів 8-9 понад 8 centimeters, please, 9, about 9 centimeters.
That's on you guys.
Yes, about 9-10 centimeters, де приблизно 9-10 сантиметрів понад раною.
But in a combat situation, you're not going to sit there and measure.
Ага.
The best thing you can
Військові,
do is
в
get
бою
it
ви не будете міряти.
as high up as possible.
Так, як найвище, як можливо.
So this might be a little like too personal information, but for men especially, when
Для
you're getting it up the
чоловіків.
leg, try not to get anything else in the leg because that will cause extra damage.
Так, для чоловіків не пошкодити нічого, так? Ви маєте на увазі паху і так далі. І, yeah,
So-
it's okay.
If let's say Cam here gets shot in his arm, right,
Якщо в
and he's
руку,
bleeding right here. First thing I'm going to do, I'm going to open up the tourniquet. I'm going to throw it up,
відкриваю,
get it as
надягаю.
high as possible as you can.
Як найвище, як можливо.
Open it, tighten it around his arm,
Затискаєте.
get it around here, let this hang, okay?
І закручуєте.
This is what you're going to start spinning. And you're going to start spinning it until the bleeding stops.
Ви крутите, поки кровотеча не зупиняється.
They might be screaming, they might be in
Він
pain,
може кричати, може пищати, але
but you're going to spin it
ви
until the
крутите,
bleeding stops,
поки кров не зупиняється.
okay? Once it stops, you're going to lock it. So you're going to bring it up here
Як тільки зупиняється кров, ви отак блокуєте паличку,
and lock it. What you're going to
закриваєте,
put this strap through
протягуєте ту смужку через це і
and
закриваєте.
close it off.
Скільки хвилин можна тримати турнікет?
How much time can we keep tourniquet like this, in this position, just because
So
it's pains?
there's been cases of people 14 hours, no problem.
О, люди до 40 годин навіть є і без проблем.
14.
14.
14.
So
До 14.
that's a good
No.
question.
Should we let it loose?
Never.
Loose up?
No,
Не,
do not loosen up.
ніколи.
The only
Коли
person who's
кровотеча-
going to loosen it up is a doctor.
Так.
Once it
Тільки
gets
лікар
on, do
може
not
це
take it
зробити.
off.
Right, and so another thing about the time question, when you put a tourniquet on somebody, you want to mark it. You can see here it says time. You do want to mark it there, typically with a permanent marker, but also put
Там є позначка, ви можете позначки робити
a big
маркером.
old T on their forehead because this might get blood all over it and they can't read it. So you're going to put a T and the time,
Може
write the
кров'ю
time down as
замаститися,
well.
ви на чолі пишете.
And if we don't have marker,
Якщо немає,
how we can...
You don't have a marker, just keep it in your head, win.
Can I try? Can I try to...
ви можете
Yeah.
кров'ю
Yeah.
замастити, кров'ю це
Знімаю,
позначити,
йду
будь-чим.
попробую.
Sharpie markers,
You can try it on me.
Dnipro, super
So
cheap.
his arm. I'll set it up for you. I'll set it up so that
My
it's
hand like
what it would look like. And
Let's
then,
imagine that respect.
yeah. So we'll imagine that you took it off of me.
Yeah.
So an important thing to remember when you guys are setting up tourniquets, keep this tab right here.
Expansion of blood back in the brain from the arm. Something to be aware of when you are treating casualties.
Можете перекласти, що, будь ласка?
Перекладайте.
Значить, прошу, я щось translating. Коли турнікет, для чого може використовуватися турнікет? Зупинити кровотечу, щоб утворився тромб, щоб забезпечити просто життєдіяльність людини.
Okay, so after we've applied the tourniquet and we have moved the casualty out of the danger area,
Після того, як ми перемінили, вже наклали турнікет і забрали пораненого із небезпечної зони,
we're going to move on to the next phase of care.
далі наступна фаза.
Once you have gotten your casualty out of the danger area, you want to apply pressure to anywhere that's bleeding. Well, okay, sorry.
Так, як тільки ви вже в безпечній ситуації, ви хочете це усунути, той турнікет забрати, і вам треба відповідний тиск накласти, щось таке, що притискає замість турнікету.
The first thing you're going to do is reassess your tourniquet. So when he put the tourniquet on him, when you move somebody, anytime you move a casualty, you want to reassess any injury that you have treated to make sure that it is still tight. It could be something like if the
Так, ви
tourniquet,
перевіряєте, чи турнікет все ще щільний, чи він є, щоб ніякої небезпеки не створити.
in the heat of the moment, in like high adrenaline, sometimes the tourniquet can come undone. It might have caught on something and ripped loose.
Адреналін, турнікет може відвалитися, може будь-що трапитися.
So yeah, always reassess your tourniquets and
Завжди
any
перевіряйте
treatment.
той турнікет, як він тримається, що відбувається з ним.
If you have multiple people with you, like me and Adam,
Якщо багато людей,
we're working together on a casualty, or even if they're not medics,
якщо навіть не медики, багато людей працюють разом,
you can delegate a role to
ви
someone. You
можете
can
комусь доручити це.
tell someone instead of like if you see a wound, you can tell someone to hold pressure on that wound
Ага,
while you
якщо бачите
continue
рану якусь ще, то кажіть комусь, поклади сюди руку,
while
наклади.
you continue to assess the casualty.
Так, і продовжуйте оціняти, дивитися, оглядати
Як воно
поранення.
він складається потім? Тобто я його склав, а як він правильно складається потім?
So the question is how to put it back.
Oh,
Yeah.
okay. So
Yes, because the first way to
we do this a little different. So this is a training
unfold, how to
tourniquet.
fold.
This is designed for rapid release. So this will be located, say,
Воно для
somewhere on your kit,
швидкісного випускання,
out,
так?
and then all you have to do is pull it out,
Відкриття.
grip like
Раз.
that, and
І потягнуло і
you
все,
have it,
відкрито.
and like that. So that's designed to
Так.
do like that.
Yeah, and how
To
to...
set it back, what you'll
Назад.
do is like leave about 6 inches through the loophole here,
Приблизно 12-10
and you're
сантиметрів,
gonna
там
Z-fold
15.
it back in on itself. Like
І
so.
його згинаєте, він сам згинається. Раз, два,
And then
і
you'll
все.
use
Тільки
this
отой хвостик залишайте.
To come over and like
І
and
все,
kind
і
of strap it.
зашпиляйте
Так.
його, затягуєте.
So
А там решта воно складається, бо
That
воно
way it's
таке,
automatic.
така стрічка.
like bam, you got it, just like that. So yeah, you'll just roll it back and do that. This tourniquet here is fresh out of the package, so it's not set up like that. This is how they come out of a package. As you can see,
Це
it's
свіженький турнікет, витягнути.
kind of similar. So to prepare your tourniquets, you will run the
Щоб
loop through
приготувати його, ви його так от
and do
затягуєте.
what we
вперед.
did earlier. So you're gonna do like a Z fold. This is another method.
І затягуєте ось
So
таким
just kinda
чином, такий ще спосіб є.
Strap it in. So that way you've
Це
got
тому, що це він свіжий, не використований ще, він тільки що його
bam. So
розпакував.
open, You got it. All right? Okay. We'll leave those out. Next, we'll move on to the casualty assessment phase.
Далі ви оцінюєте, що там є з пораненим.
So once you've moved your casualty, this is assuming your casualty is unconscious. If they are conscious,
Припустимо, вона несвідома жертва.
you can ask them, where are you hurt? Where is your
Якщо
pain?
свідома людина свідомості, ви питаєте, де болить, де що.
If they are unconscious like this, it falls to the medic or to the person that's trained to assess them. So
Якщо несвідомі, значить людина
you'll do that with visually assessing them by looking at them.
очима оцінюєте як.
If they're missing a leg or
Якщо нема
something
ноги.
that's very obvious, you know what you need to do that. So you'll apply a
Очевидні
tourniquet,
якісь поранення, ви знаєте, що робити.
and we'll go over the application of tourniquets momentarily.
Накладайте, наприклад, як нема ноги,
If
накладайте.
there's not anything apparently wrong with them that you
Якщо
can tell,
очевидно нічого немає, поранення.
Почекайте, ще одне. Наскільки далеко від рани не болить турнікет?
Якнайвище, в мужчин найвище до паху. Вище над раною до 10 сантиметрів. Це були попередні сесії.
so you'll move on to what's called a hand sweep of the casualty. And what you do, you start on the neck, you run your hands like this, up, and you look.
Ви починаєте з голови і починаєте обмацувати руками.
So look at your hands. If you see blood, you're
Якщо ви
gonna,
бачите кров на руках, так,
you will
шиї,
pack the wound with combat gauze, which is that
і
stuff,
ви
the white roll.
накладаєте
If you see blood, you'll pack the wound. So we'll go over wound packing later. But start there with the neck, and at this point, you want to put on gloves so that you don't get
вдягайте
blood on your
рукавички.
hands.
Звичайно, коли ви оцінюєте шию і так далі. Коли там рана, то ви накладаєте там, де марлічка. Оце що.
Марлю трамбуємо в
так.
рану.
All
так, це
IFACs
те, що
should
показує.
have a pair of plastic or sterile gloves
Там
inside
ті
them.
подушечки, ці всі вони вимагають, щоб рукавички були стерильні. Так?
Not only are you protecting yourself from possible blood-borne diseases,
Ви не тільки себе захищаєте від від різних заражень, так і від крові.
you're also protecting your casualty from getting bacteria and germs that
Також
might be
ви
on your
захищаєте і
hands.
пораненого
into
від
the wounds.
проникнення якогось зараження, інфекції.
Right. Okay, so you start at the neck here,
Починаєте з
look for
шиї,
blood,
дивитеся, чи кров,
switch to the arms,
руки,
here, look for blood,
дивитеся, чи шукайте, чи кров є.
А
across to the
якщо,
other side,
наприклад, на шиї буде десь поранення, або там, де неможливо поставити турнікет?
look for blood.
Зараз.
Береш марлю
She's asking
і
if
туди в
there
рану.
is blood flow somewhere where you can not put on tourniquet.
Yes, we will talk about that.
Yes, пізніше трошки пора.
Yeah. So, sweep here. Once you go to the chest cavity
Переходите
here,
до грудної клітки.
you want to do what's called bare hands, bare claws. You're going to
Робите
rake,
такі, як ведмежі лапки, тобто кігтями.
you're going to rake across the
Легенько.
chest. So you're going to go down here, down, because if the casualty has a hole in their chest or in their cavity, with your fingers, you're going to feel it. But if you do like
Ага,
this,
якщо там є якісь
You're not gonna
проникання, якась діра, ну щось,
I
якась рана
have a
така.
question.
Значить,
Should we take off the clothes or not?
during this phase of
чи
it,
нам
no.
слід знімати одяг,
Because
якщо?
you have just, if they're wearing like kit, like if they're wearing
Якщо вони вдягнуті
armor,
щось,
you will take the armor off.
Ясно.
But if they're wearing
Якщо є
regular
бронежилет,
clothes
Якщо
like
це
зняти.
амуніцію, ви жилетку ви знімаєте.
одяг
це,
не знімати.
But not clothes.
Not clothes.
Not-
So
одяг не
you won't
знімається.
take them off, but you can
Тільки
unzip his
амуніцію
jacket
знімаєте, розшпиляєте,
to
тому
like
що вона...
expose it, but you don't want to take them off because you might have to move them again quickly.
Ага, ага.
So the
Неможливо буде вдіти бігом
Так.
назад.
The rule of thumb is if you're dealing with soldiers or people that have body armor on, what you'll do is you'll take the plates off, you'll conduct your
Пластини ви знімаєте і все, для солдата це правило.
your
А
chest
потім
sweep here
і
across the
перевіряєте
abdomen,
легенько.
and you'll also do the same on the back, which
Таке
I'll show
саме
you
на
how to
спині
do.
робити.
So you'll roll him over.
Повертаєте
This.
його.
You don't need to move him a lot, just enough to like kind of check.
Не треба його сильно перевертати,
same
просто
thing.
достатньо, щоб...
Each time look, and
Стіни.
then opposite on the other side as
Кожного
well.
разу дивитись, чи нема крові.
So check both sides. Once you've conducted thoracic area search with the hands if they're
І тільки
soldiers.
ви грудну клітку перевірили.
And if they have armor, you're going to put the armor back on them
Якщо вони мають амуніцію, то ви то
because it's going to
знімаєте.
protect them if you have to transport them.
Треба вернути назад. То, що він має бронежилет, вернути назад на нього.
So and then moving from that point, that includes like the scrape. These are the areas you can't apply a tourniquet. Here, limbs and extremities, that's tourniquet. This is where you would apply something called a pressure dressing and a bandage. You would pack the wound and then you would apply a pressure dressing to it.
Так, турнікет ви можете на кінцівках накладати, а тут ви
We'll go over
можете,
that. We'll go over that in a minute.
а тут ви
So,
тільки подушечки накладаєте,
Moving
щоб
on
рану закрити.
from the torso area, you're going to conduct with the legs the same way, not with the bear claws, but with your hands up, sweep, and with the legs, it's important to
На
stop at the
кінцівках
knee.
ви
You go
руками,
thigh to knee to feet.
вже не
And
так
look,
кінцями, пальцями, як на грудях, але тут.
because they're much bigger than the arms,
Got
and you want to know where the damage is. So same thing on the other
Кожного разу
side.
зупинятись на колінах, а
І
тоді від
перевіряти,
колін
чи є
і
кров,
далі.
так.
Не одним махом одну ногу.
А якщо, наприклад, поранення десь тут, все одно накладувати турнікет сюди?
The question is if the wound is somewhere on the wrist,
Yeah.
where to put on tourniquet? Here?
So that's okay. Yeah, we're gonna go into tourniquets now. Actually, the application of tourniquets. So if there's a wound on the wrist or anywhere on a limb, the best thing you can do is you put the tourniquet as high up as it can go.
Так.
As
Як
close as you
найвище
can to
на
the limb.
руці, навіть якщо на
That's it.
зап'ясті.
So for the legs, it's gonna be right up to about here where the thigh is, and on the arms, obviously, it's gonna be in the shoulder. So
На руках тут аж до паху,
Daniel
сюди
showed how
турнікет, а на руці до плеча.
Daniel showed how to apply the tourniquet before.
Yes,
Okay,
yeah,
right,
yeah.
okay, so all right, you guys saw that. Yeah, so when you're applying tourniquets, always go as high up as you can on the limbs, or in any of the limbs. You're going to
Тобто як найвище, на руці, на нозі,
get a tight cinch, and then you're gonna
зафіксовуєте,
bring it back, the
блокуєте,
Velcro. You're gonna twist the windlass
тернете,
until
повертаєте,
the bright red bleeding stops.
аж поки кровотеча не зупиняється.
Did Daniel talk about the
Yes,
difference
yeah,
between
yes,
blood?
sure.
Okay. So
Everything.
bright red bleeding is full of oxygen. That's
Червона
arterial.
кров поки не перестає.
The dark red bleeding is not as serious. It's still serious, but it's not
Темно-червона
life-threateningly
кров
serious.
це не дуже серйозно.
But-
Ну, не конче серйозно, а яскраво червона кров це дуже серйозно. Тобто припиняти, крутити аж доки кровотеча не
Okay.
Це з різних, я розумію, вен просто чи артерій, чи
Темна венозна, світла артеріальна.
Okay. So after you've done this, then you're going to move into if you have a wound here. I can't really give you a good example of wound packing, but what it will be.
Неможливо зараз
But you can get
показати
up.
гарно, як закрити рану на грудях.
So wound packing is essentially taking gauze like this.
Оце береться.
And you
Сама,
can,
звичайно,
yeah, you can
Yeah,
take
that-
it from this side, or you can actually pull it out from the center here and pack it in just like that. So if
Або
you
брати
have a
серединки.
penetrating wound on the chest, you'll take your gauze and you're going to pack it in. Pinch,
ви
put the next one in, and pinch.
Затичку
So
таку робите
the
в тій
idea-
рані пробиті.
the idea is to get as much pressure in that
Так.
wound as you can, and you want to
Затиснути.
always keep pressure on it.
А, наприклад,
Як
якщо в рані
найсильніше.
залишились, наприклад, осколок або пуля,
If the
ми її
line
не
is-
дістаємо.
Splinters or bullets in the wound and what to do.
So if
Її
you
не діставати, я розумію. Чи...
if you
Should we
do
take
have
out the splinter or?
no.
No.
So if you do have any kind of foreign object in a wound, you
Якщо
want to
якийсь-
leave it there. Leave it there because if you pull it out,
Залишаємо це все там.
it can do more damage and cause more
Бо
bleeding.
можемо щось ще
Що-
більше спричинити
It
шкоду.
may also be blocking an artery or a vein
Це
that
може
is
блокувати також і
that
артерію
it's
або вену.
that's the only thing preventing it from bleeding more.
А,
So
просто відрізати кусочок і як затичку прямо туди,
Так,
в ту
так,
рану.
так,
Не
так.
відрізати, а просто запихати.
Запихати
повністю.
це,
Воно-
нічого не
Воно там
відрізати.
злізе переважно майже вся оця
She's
штука.
asking
Все
whether
має.
to tear
Нічого не
a piece
відрізається, потім що
from
лишається,
the
воно просто
ghost
притискається.
or just to
what's that?
a piece,
To tear a piece?
to tear, just to, well, to cut the piece from the.
You need to
From the
cut
gut?
a piece from
Take a
this
piece
one
or take the whole.
No, just use the whole roll like this.
Вживати,
So
використовувати цілий
once you've completed your wound packing and you've got pressure on it, you'll use your medical scissors. Typically,
Там є медичні ножнички, і ви це все
this
заносите,
is
або
this is a
відрізаєте.
different part. This is a different part. That's after. So
Це
you'll
вже
use
трошки пізніше.
once you've got it done, then you just clip like that. And so you can either clip it or you can use the rest of this to wrap it around.
Ви
like he
можете
was saying.
довкола обернути, так, щоб решту
But
використати.
typically you want to do like that. You can wrap it, but the next portion of that would be to apply what's called a pressure dressing. And I don't know if this is a pressure dressing,
Або додатково ще
but
оце
essentially it's the
використовувати
same thing.
зверху.
It has a bandage side here. So if I was doing a pressure dressing on my leg, and this isn't a pressure dressing, this is just a regular bandage. So you
Це
would wrap it
звичайний
where the wound
перев'язка.
was after you've packed it. You would wrap it around tightly, just in the same way. So
Якби
you,
заблокували рану,
Yeah.
і
Wrap it
тоді
around
зверху
tight.
цим.
and it's like for this, it's okay to get it a little tighter than it should be.
Трошечки тісніше можна.
The way you
Це
want to wrap it.
перев'язочний бинт,
Так,
є,
так,
але
це
там ще є
звичайний.
подушечка, типу як звати,
Звичайний.
правильно?
Це зверху по штанах, не потрібно розрізати.
So
But about the clothes,
At
about
the-
the clothes, should we apply it about the clothes?
at this point in care,
Так,
yes, yes.
так,
At
так,
this
по
point in care,
одягу
just
нічого
leave it
це.
because you're still in a danger area. You haven't evacuated your casualty. You just moved him away from immediate danger.
Так, просто
So,
ви
yeah, don't-
забираєте від небезпеки.
Yeah,
Це
don't
все.
worry about the clothes right now.
Не
Like right now, it's
тривожтеся
just
про одяг зараз.
keep them
Даний
along,
момент.
keep them alive long enough to get them to a higher level of care. And
Головне
then when they get to the
зберегти
higher level
живим.
of care, they'll remove the clothes, they'll reassess the wounds, and they're going to do other things when they get there.
До безпечного місця, а там вже можна все
So
обдати безпечно.
you'll use these hooks.
Так.
You'll use these hooks like that.
Бачите цей гачок?
They clip in like
А
on
ось
the
таким
edge,
чином
just
ви
like that. So
закладуєте, то
and it makes it
затягуєте.
harder to get them off,
Ага, і
So.
потім можете легко зняти.
as you can tell.
Зафіксувати і зняти.
We use this bandage only in chest,
You can use this bandage you can use it all over the body. But
Це для
but
тіла,
yeah.
but
тіла можна
but on legs
використовувати.
and arms
Yeah.
only tourniquet.
no. So when you have a tourniquet, like you're going to put it on there, but after that you would use these.
Ага,
So then you would
це
use
поверх турнікету.
yeah. So it goes tourniquet,
Ні, турнікет лишається,
Fresh.
а це не рана.
Турнікет
and
лишається,
pressure
це
dressing
поверх.
on the
Можна-
actual injury.
Ah,
Так.
okay,
Yeah.
okay,
Yeah.
okay, I see.
So these are just you can't put a tourniquet around the torso or on the neck. So that's you do the packing and then
Через
you do
те,
the
що
pressure.
неможливо турнікет накласти на тілі, тільки на кінцівках. Тому ця пов'язка
All right.
по турнікету або на тілі.
Тобто турнікет
Зверху.
спочатку, потім засовуєте в
Так,
рану
так.
цю марлю
На
і
тілі
потім
спочатку-
перемотуєте цим всім
А на
бандажом.
тілі,
Так.
якщо є рана, то спочатку рану закриваєте тим тою марлею, так, у затичку, і тоді зверху.
Okay.
Okay, so right now we're going to move into what's called, it's an acronym, it's called MARCH, and it just stands for, it probably doesn't make any sense in Ukrainian.
Акронім він називається Марч.
So,
Марш, одним словом, але
Yeah,
що
so
є щось.
it stands for mass bleeding,
Ага, якщо є hemorrhage, якщо є кровотеча сильна,
Airway.
потім дихальні шляхи,
respirations,
ну тобто дихання, так, іде циркуляція
Circulation.
і гіпотермія.
and hypothermia.
Оце
So
є акронім, який означає оці.
we're going to go into those
Це
more.
не акронім, а
Я-
це пункти, по яких ви маєте
Марч,
йти.
не
Перше, це
акронім,
кровотеча, так.
abbreviation, тобто
Так,
ну,
так.
Абревіатура.
абревіатура, вибачте.
So what this is, what this abbreviation helps you remember is the most critical parts of assessing your casualty.
Ага,
Because
це найосновніші пункти, коли ви оцінюєте свого пораненого,
yeah,
так?
and we're going to pass some of these out to you guys.
І зараз ми будемо проходити за
so-
порядком їх.
A casualty will die from mass bleeding before they will die from an airway problem, like not being able to breathe. And after that, it's respirations and circulation. and hypertension.
Значить, кров, спочатку кровотеча, потім дихання і
Тобто
дихальна система,
перевіряти
так?
дихальну систему чи
Тобто все за порядком. Найперше, по мірі тобто як воно
По мірі
найважливіше.
можливості. Перше,
Так,
саме основне,
перше
припинити кровотечу, бо
кровотеча.
за 60
Потім-
секунд людина вмирає.
Так,
А
так.
після кровотечі вже оцінюється все решта.
Дихання,
Дихальні шляхи і потім циркуляція
дихання
крові
сама,
і гіпотермія.
циркуляція крові і гіпотермія, тобто переохолодження,
So for the first part of this, you have mass bleeding or a hemorrhage.
кровотеча.
What you want to look for are large amounts of blood. like that's the,
Шукаєте, де є сильний круг,
Tourniquet,
сильна
large amounts
кровотеча,
of
там
blood.
накладаєте турнікет.
so you can apply a tourniquet, which we talked about,
Можете
or
накладати
pack the
турнікет.
wounds, like we talked
Потім
about with
або
the abdominal
запаковувати,
stuff and the pressure
закривати
dressing.
ту рану.
And then you also want to assess the mental status, like assess if they're
І потім
conscious.
оцінюєте, одночасно ви можете оцінювати ментальний стан.
Yeah, if they're conscious, you
Психологічно, чи він
continue to
при
assess their mental
свідомості.
status. Like when Cam fainted,
Так схоже, як
we
Кемерон.
were kind of talking to him, asking him
Можете
questions
питатися
to see what his mental status was.
як
He,
він
he
відповідає,
seems a little bit dazed and kind of
чи
confused.
щось в нього
So
запаморочення є
that's normal after
раненого.
what happened with them for that to happen.
Питатися, що
But it's
трапилося.
important to do that because if a
Важливо
casualty,
це робити.
especially a casualty in a war zone, the last thing they're going to remember before going unconscious is that
Важливо те,
they
що
were
було в останню
attacked.
секунду
So
перед тим.
when if they become conscious,
людина.
they're going to still be in a frightened state of mind and feel probably very threatened, even if you're trying to help them. They might not know
Можуть
that,
бути перелякані,
and they might not have the mental state to understand that.
і вони можуть і цей стан, щоб зрозуміти, що з ними відбувається з пораненим.
Next up is going to be for airway. And,
Так, дихальні
we'll lie down
шляхи.
again real quick. So
Зараз покажу.
when addressing the airway, you want to be careful about moving the neck and the head
Дуже
around.
обережно щодо
So
шиї і голови,
to open the airway, what you do is called
щоб відкрити дихальні шляхи.
head tilt and chin lift method. So you'll position your hand
Метод
here.
наступний.
You're gonna position back,
Ось
and then you're
так
gonna press the
робите і
chin down
відкриваєте,
like
рухайте
that.
головою так і відкриваєте рот.
This
Найперше.
minimizes movement of the neck and spine and
Це
allows you
мінімізує рух
to observe the
тобто
airway if for any obstructions or
ви
damage.
мінімально рух шиєю рухаєте.
So when you assess the airway like that, you go to those.
Коли ви
That's good. You'll
оцінюєте,
check, and then after that, you're gonna do what's called SILS.
це ви
It's an
переходите до
acronym again.
наступного.
Sorry, we use a lot of acronyms in America. It's stop, look, listen, feel. So what you do,
Зупиняйтеся, подивитися, послухати і помацати, тобто відчути, як воно є. Це 4 найосновніші.
okay? You put your left ear or right ear,
Вухо
depending on the side,
прикладаєте,
to the casualty's mouth, and you listen.
зупиняйтеся, слухаєте,
Listen to hear if they're
вухом,
breathing.
чи він дихає,
You look for the
дивитеся,
rise and
чи
fall
він
of their
піднімає,
chest,
чи груди піднімаються,
and you feel for like the rise and the fall of their chest.
і покладете, і відчуваєте це, кладете
it's
руку і відчуваєте.
It's important to feel the rise and fall of the chest because
Важливо відчувати, чи груди
when you look at it,
піднімаються.
it might seem normal, but if they have damage to ribs that you can't see, you will likely feel the chest rising and falling at different rates
Якщо
instead
є
of one.
пошкодження в реберній частині, то
feel,
можете таким чином хвильками
If they have a
відчувати це.
punctured lung, sometimes, if you're very aware, you
Якщо є
can feel
легені
the
пошкоджені,
breathing feel differently than it should normally.
Може
It'll feel
відчуватися.
like bubbles, sort of.
Є щось, як
I don't know how
бульки.
to describe that. Okay,
Через
so
те, що
Тобто
знаєш,
важливо
коли ходить
важливо відчувати рукою, покласти руку, і ви тоді відчуваєте різні моменти. Він написав, коли є поранені ребра, коли є якась всередині внутрішня кровотеча і так далі.
okay, so the main thing in assessing the airway is to the head
Найголовніше
tilt, chin lift, and be sure to clear any obstructions from the
очистити
casualty's
дихальний
throat.
шлях у цей перший спосіб.
Also, be careful that if they're unconscious, a lot of the
Обережно
time,
тільки, якщо людина
they're-
несвідома,
their tongue will relax and it will fall in the back of their mouth,
язик може запасти всередину,
and they can choke on that. So
і вони можуть.
if you can move your casualty, we'll talk about the recovery position, but that's what you saw with Cameron when I pulled him up on his side, because that allows your tongue.
На бік трошки, і тоді
To hang out instead of
язик
like-
може
А як
не
очистити дихальні
перешкодити.
шляхи, от вони казали?
От мінімально шию порухати, ну тобто голову отак назад чуть-чуть
Просто
відкрити.
виводиться щелепа, щоб получалося
Виводити щелепу. Ой.
не западав. А щоб очистити, то пальцем, то та.
Ну,
Потім
він того не
пальцем.
показував.
Але він того не
просто, щоб-
показував,
так,
якщо
він
багато
перед-
всього, то ви мусите тут зробити. Він потім-
Okay, let's see.
So the doctors are telling about how to cleanse mouth, cleanse airways.
Якщо
Yeah,
там
so
блювотні
it's good.
маси є, то
Yeah,
легко.
if he well,
Right. You can use your fingers and
Так, можете використовувати пальцями, тобто очистити, якщо рот заповнений чимось.
however,
А,
тобто
so
ви
if
розумієте,
the teeth
так,
are-
там
if the teeth-
teeth are locked.
Yeah, так, yeah.
So if
А
the
якщо
teeth-
зуби
Затиснені, то треба
затиснути,
If the
Оце
teeth
вивести, то, що він показував ще легко.
так,
if the
так.
teeth are locked, you can use this. It's called a nasopharyngeal airway.
Ага,
It's
якщо
just-
зуби
Basically, it's a
заціплені,
tube that goes in
затиснуті,
your nose and down the back to the throat,
це
and it
через
allows
ніс
you
іде
to breathe.
трубочка.
If you can't access their throat to clear any obstruction,
Ага,
you
якщо
can
не
insert
можете
one of these.
допасти, не можете відкрити дихальні шляхи.
Це вносить
Це і називається назофарингеальна трубка, але вона є різних розмірів, і треба мати різні розміри цієї трубки.
So they're very uncomfortable.
Yeah, different sizes, they should be different
Yeah,
sizes.
they do have different sizes.
Yeah.
Either way, they're always uncomfortable. No one likes to use
Завжди
an
вони в
NDA.
нас зручні є.
So the way that it works is,
Ось так воно працює.
okay. So basically, what you'll do is where your patient, while your patient is lying, you always put it on the patient's right side, the patient's right side nostril.
Ага, на праву ноздрю,
Right.
ніздрю має
Yeah,
воно
the patient's
входити.
right side, because typically our right side of our bodies are a little bit bigger than the left.
Ага, тому що права ніздря зазвичай вона більше трошечки, ніж ліва.
So when inserting it,
If anyone is left-handed.
yeah. So
Якщо в нас лівша, то
It's
може
not a...
Перевіряти на
Права сторона в тіла все рівно більша, навіть
Так, все одно
у лівші.
Yeah, yes,
okay.
the right
So
side
the
is
way that
bigger.
it's in is you'll have the bevel facing in like this. So like this part, the cut, faces the center of my nose. The
Ага,
center of
таким
the
чином
septum. So it goes
поставити,
in
щоб
like this.
це
And
і
the reason
права
for
та
that,
вістря
once it reaches the back
до
of the
носа,
throat,
до кінчика
it
носа.
allows it to breathe and it doesn't have as much obstruction.
І тоді ця трубочка
back.
дозволяє, якщо вводити, то
максимально
вона...
глибоко її вводити до кінця,
Так,
майже
так,
до
воно аж
закінчення.
сюди.
до тої штуки.
А
Okay.
оцим зрізом, тобто цей зріз має бути
Зріз туди,
де...
так, і зріз вгору,
Зрізом до центру, так.
Okay, so respiration, so we're breathing. Next, we're going to go in for circulation.
А далі
So-
перевіряємо
You're going to seek pulse. You can do that several
Pulse.
different ways. A
пульс,
pulse
наскільки
you feel on the wrist, and you'll feel the pulse. You can do it on yourself if you'd like,
знаєте як.
and you'll feel it also on the carotid
Також
artery.
на шиї можна
It's a good one. That's what I
перевіряти
always start with the carotid artery just to see because it's easier
пульс. Я
to feel.
починаю із шиї.
You also have a pulse on your foot.
Також можна пульс
that you check, and so
на
feel for the
ступі
pulse.
перевірити.
You don't need to know a lot about the pulse, but if it feels strong, like if it's
Якщо він відчувається
rapid
сильно
and strong
пульс,
and easy to feel, then
пульсує
that's
легко,
a good thing.
відчувається.
If it's very weak
Якщо дуже
and
слабкий
kind of
пульс,
flowing slowly, that's not a good thing.
це не
there's-
дуже добре, на противагу попередньому.
There's not much you can do about that at this point, but you just need to continue to
Небагато ви
monitor.
тут можете
Like,
зробити, але
yeah, continue to monitor.
продовжуйте.
Якийсь адреналін вколоти, ні?
То вже
What
тільки
should we
медики
do?
можуть робити.
What's that?
They were asking about
There's
if
really-
the pulse is weak.
Because of the
Слабко
pulse
про-
at this level for first aid, there's not much you can do about it,
При першій
unfortunately.
допомозі ви нічого не можете тут зробити.
Yeah.
Це для лікаря, щоб оцінити. Головне, щоб живого
But it's
витягнути.
important to monitor it and monitor the pattern
Обстежувати,
if it's getting
стежити
worse
за станом
or if it's
пацієнта.
getting better. Because when you hand that
стає
patient
краще,
off
чи
to
гірше.
like paramedics, that's information they need to know. Okay.
Тобто ви час
Міряти весь час пульс і
стежите
потім сказати
за
медикам,
станом.
як він...
Next up, we're
Як
going to
той
go
пульс
over
був.
hypothermia.
Так, тепер до
And that's the last step in March.
гіпотонії.
Hypothermia is becoming very cold very quickly, and it is a very common symptom of blood loss. When you lose blood, your body loses the ability to heat itself.
Поширений симптом втрати великої крові.
So watch for signs of shock. Some of those
Дивіться, чи
signs,
шок є,
like
ознаки.
Cameron, when you saw earlier, he was experiencing some mild shock.
Чи
He
якийсь шок
was
є в
confused,
людини,
and
чи
his skin
заплутаність,
was pale. He
чи ж
didn't.
бліда шкіра,
Sometimes you'll see what's called cyanosis or blue in
або
the soft tissue,
синенькі
which
нігті,
is the lips
голубоваті нігті,
and on the
губи.
fingertips. he didn't have that, which is a good
Кінці
thing. That is a very extreme sign of hypothermia
Це
and shock.
надзвичайні ознаки. Тобто
Never give a casualty any kind of alcohol because it thins your blood.
дайте
And-
трошечки будь-якого.
Не можна давати
можна
алкоголь.
Yeah, don't give alcohol. And
Не
another
давайте.
thing to be careful of is like aspirin. There's a medication called aspirin. You don't give that to a casualty
Не можна теж
because it also
аспірин,
acts as a blood thinner. It'll make them bleed
тому
more.
що воно розріджує.
So yeah, it's when people have lost blood, it's very easy for them to go into shock, and because of hypothermia. So
Якщо
that's why we do
людина
these steps, and I'm going to go
кров,
into
легко
those
вона
steps.
дістає гіпотермію.
Never place a direct source of heat on or near the casualty, like also, because that can cause another issue. Only warm them if you can keep the changing temperature. And let's see. Oh, here's signs of shock. I'll go over that in a minute. But like you saw with Cameron, he was feeling very cold. That was because he had experienced a seizure. He was in sort of a state of shock just because of, I don't think it's neuro something shock. It's caused by a neurological process in our body.
Неврологічні процеси можуть спричинити якісь гіпотермію.
Стресова ситуація,
Так,
і людина
стрес.
втрачає температуру тіла, починає замерзати.
Yeah. Essentially, our body is trying to compensate for trauma or loss, like something like that, and that's what can cause shock. That's caused by either hypovolemic or hypervolemic shock, which means either too much blood or too little blood.
Перекладайте, будь ласка.
Вибачте, тому що паралельно, знаєте, збиває, і я просто
Я перепрошую.
гублю нитку, тому що думаю, ви вже почули щось. І це.
Ні, ну,
Well, I'm sorry, just explained because
Can you repeat?
other
about-
other ladies, they interrupt, and I think that it's clear for others. That's why I'm silent. So then they ask me to repeat again.
No problem.
So
No, it's
just
okay.
could you repeat the last part about
About blood, about...
Oh, okay. That's it's not really applicable to this course, but it's just it is an explanation.
Це просто пояснення загальне, воно не відноситься до цього курсу першої допомоги.
What causes shock is your
Що
body.
спричиняє шок?
Your
в
body,
вашому тілі?
you have blood veins in your body, right? Veins and arteries.
Ви маєте вени.
When you go into shock, it's either because your arteries are constricting too much or because they've
Або
opened
занадто
up too
звужуються,
much.
або
And
занадто
both of
розширяються
those
ваші
things
клітини кров'яні.
they cause your blood pressure to drop
І вони спричинають те, що ваш тиск кров'яний падає.
or to increase. It would increase.
Або
If
збільшиться.
they're like tightened up, your blood pressure is going to increase, and you can. And if it's out like that, then you go into like hypovolemic shock, which is low volume.
Тобто або збільшується, або зменшується
So
тиск.
what that does is
Понижується тиск.
when your blood vessels open up so much, your heart can't push them through at the correct pressure.
Це
So
створює причини для
it's like
труднощі для
it's like
серця.
a water hose that has only a little bit of water going through it because the hose is too big.
Серце не може перекачувати кров.
So
Відповідно, якщо занадто клітини розширюються, кров'яні клітини.
What you can do to prevent shock is pretty much what you saw with us doing with Cameron. You take them, you lie them down, you get them away from any
Як ми
kind
робили
of
з Камероном, ви кладете його,
extreme heat or extreme cold. If they're feeling hot,
перевіряєте, що вони
then you want to
відчувають.
loosen up their clothing, like
Якщо
you did.
жарко, розпиляєте.
Like take their clothes, like loosen up their clothing
Знімаєте.
under their belt if you need to. That's
Полегше,
kind of what the scissors
послаблюєте
are
ремені,
for. If it's
замочки.
really bad, then you're gonna just take their clothes, like cut them off
Можете навіть
completely.
знімати або
And
розшпиляти,
another thing
розрізати
is
одяг.
under their boots and
Також
any
черевики розв'язуєте.
take watches off and rings, any
Годинники,
kind of
все
restrictive
послаблюєте,
item
те, що зможе стискати.
that could restrict blood flow is going to
Може
contribute to
перепиняти
shock because it makes
кровотечу
it harder for the body to
до рук,
circulate
крові
blood.
по тілу.
So like belts, pants, make sure that it's all very loose, undo it. But if they are, and you still want to do that, even that's specifically when they're hot, but you still want to loosen up their clothes and the restrictive items when they're cold, because that can put them into shock too. Make sure you don't take their
Також і
clothes
це
off.
робите, коли їм холодно.
Make sure you don't take all their clothes off if they're cold, because that's going to make them more cold. But what you do is you wrap them up like that, and we
Ви
put,
загортаєте
you saw
їх.
we put blankets on Cameron.
Кладете ковдри зверху,
That's what
огортаєте ковдрами.
І на нас
Yes,
Daniel.
there is a blanket.
Okay.
Here.
Okay. Yeah, so this is, oh no, well, this is a triangular bandage, it's a little different. But yeah, so you saw the blanket earlier, it's like a big shiny piece of foil. And that helps, that helps reflect body heat into the body. So you'll wrap them in that and keep their blood flow, like keep them warm. That helps prevent shock.
Це допомагає, щоб шоку
That
запобігти.
blanket has two sides. One side
Yeah.
is yellow, the another side is white.
Yeah.
It's about heat. It's about warm and cold.
I'm not sure. I think that one is different. I haven't looked at
Питається, там є дві
Yeah. I
сторони,
haven't looked
золота
at
і срібна.
Daniel's.
Кажуть, переважно нас вчили, що золота доверху.
We are using these blankets in
Yeah.
tourism, and I can say that the yellow side is to make your injured person warm.
So the yellow side is on the interior.
You need to use yellow size inside.
Inside, okay.
To warm and
Outside to cool.
yeah, and
Okay,
inside. And when you're using like you want to feel your injured person, not warmer but cooler, you need to use white side.
Okay, got you.
Значить,
Good,
якщо
good to know.
холодно,
Thank you.
треба срібною стороною тіла.
Якщо для того, щоб зменшити температуру тіла, потрібно використовувати білу сторону ковдри всередину для того, щоб не нагрівати людину. А жовта сторона має бути всередині, якщо ви хочете зігріти людину.
Навпаки.
Навпаки.
Біла має бути всередину, якщо хочете загріти, або жовта ніби там
So yellow side is for warmer.
Protecting. Just
Okay, good to know. Yeah,
cooling.
that's, I don't have blankets like that. That's why I don't
Yes.
know. Daniel does. He's more high speed than I am. He's cooler than me because he has the good blankets. I just have a
They were
regular.
confused from both sides. Actually, one of them, they had two different opinions, so it's okay with you.
Cool. Okay, so that pretty much brings us through the course. That's at least all that I have. Do you guys have any questions about
Чи ви
some of
маєте якісь
that?
запитання? Ми вже тут майже
A suspected injury to the
поранення
spine or
підозрюєте,
neck.
що у вас є
When you
поранення.
move them, now this isn't for care under fire or anything like that. This is a
Це
step.
під вогнем,
This is a
якщо у
step
вас
past
є.
that. This is whenever you're moving your patient to get them to a higher tier of care. That's what this is. In combat medicine, we try to save lives, not limbs. We try to save everything, but if they're better
У
off,
звичайній медицині ми намагаємося
sometimes,
врятувати
if you can get them out alive, it might
Життя.
suck that they lose, control of their legs, but it's better if you can get them out of a combat zone like that. That's like,
якщо вони
that's
втрачають
that's called emergency
відчуття
movement.
кінцівок або
And you
взагалі
only do it
втрачають
when
кінцівки.
you're a casualty or you are in like immediate danger. If you have the opportunity to do it, we'll go into that now. This is moving a casualty with an injury to the spine or neck. So when you move a casualty like this, even when you're doing your assessment, you need a minimum of 2 people. And the first person is going to be
Щонайменше треба двоє
what we
людей.
call
Перше, що
the
робите?
head man. So you'll also utilize this, as you saw earlier when they put the spine board next to Daniel, that long straight board like a stretcher. Or not Daniel,
Подошку
sorry,
збоку
next to Cameron.
покласти, так.
You'll utilize this. So what it is the head man will literally get down like this,
Людина,
and
яка
yes,
при голові
you just want to
є,
keep
так?
the head steady.
Ось
You can
таким
get down like
чином,
that, and
щоб
when you
голову
move,
тримати стабільно.
you'll hold the head like this. Just
Таким
make sure that
чином
it doesn't move.
тримайте, щоб найменше рухати.
All movement of the casualty is at the direction of the person holding the casualty's head.
Ага,
His job is
весь
to
рух
keep the
має
spine
бути тільки
straight.
в напрямку тої людини,
So
яка тримає голову.
if we were doing an assessment here of Adam, and this was my partner, we would prepare to move him like this. I would be here holding
Якщо ми
his
з
head.
того боку,
We would put this leg over,
ми таким чином
and we would bring this
робимо.
leg up like that.
Руку, ногу.
And you, sir, you'll get down here on your knee. You're gonna grab a hold of his pants
Отам
right here. You
захоплюєте,
can use a belt loop,
за штани
or
можете
a
за
belt
ремінь
is really good.
захопити.
You'll grab
Тобто з
it
двох
with
різних
your right
позицій,
hand here,
залежить звідки людина підходить,
and then
або
your
з
right hand
голови
on the back
боку,
of the
або з
shoulder
боку.
here. Like you'll grab a firm grip, and then and we're just gonna kind of roll him toward you.
Так,
Casually.
повертаєте, якщо з
Yeah,
того
yeah, so
боку
when we do
повертаєте
that,
на бік
it'll
обережно, але голову
roll him,
підтримуєте.
and then I will
В тій
hold his
самій
head like
позиції
this.
це найважливіше.
While my partner conducts an assessment of the back or while we move the spine board into position.
Так, зверніть увагу ще на ту.
And then,
на ногу.
so how that'll work is I, as the person holding his head, I will say, we're gonna move the casualty on the count of 3. 1, 2, 3. So I'm prepared and
На
I can
рахунок
stabilize
рухайте
his head.
одночасно. Тобто
Okay, so
раз, два,
obviously,
три. І разом.
so this is with a suspected
Але
C-spine.
нерухомо тримайте спину і шию,
Yeah, you
голову.
wanna
Так.
keep it lateral. You don't
Так,
want
так, щоб воно
the
було
least movement as possible.
найменше.
If you have the ability to use what's, okay, we can roll that. You're good.
Це не зовсім до питання, що я хотіла, але хай буде.
Yeah.
Запитання, як компонувати
If you have the ability to use a spinal, like a C-spine collar, you want to use that.
Якщо ви маєте комір для шиї, то ви користайтеся тим.
Yeah. Use the
Well,
C-spine.
there was a question about wound, neck wound.
Okay. A neck wound?
Yeah, if it's clear, blood
If we
bleeding from neck
Yeah.
wound.
if we had blood on our neck and it's bleeding a lot,
Yeah.
how we need to stop this blood on
So you can't put a tourniquet on their neck because they'll die.
Не можете турнікет на
I
шию
mean,
покласти.
unless you really don't like that person.
Може, хіба що якби то не любите.
Давайте це, ти ще пов'язки, як ви
Yeah, no. I'm kidding.
So
But no, so it would.
tight bandage.
It's the same as the wound packing with the gauze, and then you would put a pressure dressing on their neck. So wrapping a neck is a little bit different than wrapping, say, like a body or another part. When you
Я хочу запитати, дивіться,
When you
є
wrap a
кілька
neck,
людей,
go ahead and sit
він затампонував і має лишити ту пов'язку. Ну не може він постійно біля тої людини висіти. Як її обмотати, щоб можна було людину лишити з тою пов'язкою? Є методи, але я не знаю, як це перекласти.
They would like to know, to learn the way how to deal after the packing and bandaging the wound. Just it is left safely for some time after packing and
okay, so
bandaging.
at that point, at this level of care, there's
Yeah.
nothing else you can really do about it. If they're bleeding severely from a neck wound, that's going to require surgery. So you're going to have to get them to a hospital as quickly as possible.
То якнайшвидше в
Yeah,
лікарню.
there's
Тут
nothing you
багато
can do
дуже
about
нема
it
що
at
робити.
this
Буває
at
таке,
this
що поки
level.
вести, а от не може лікар біля нього
Yes,
сидіти.
it happens that it takes time,
Yeah.
some time to get to the hospital, and a doctor cannot stay at
Right,
the
right.
patient.
Unfortunately, that's all we can do at this level, as far
На
as
жаль,
we
це
have.
все, що ми
can
можемо
you
зробити.
show please how to put this
Yeah.
on the neck?
So,
Як це робиться на шиї? Прошу
So-
показати. Ось.
when you pack a wound packing a wound on a neck, you'll do the initial packing with the
Так, ви
gauze.
спочатку робите оце з
And I'm gonna do
ниточкою,
it on
так,
this side. What you'll do next is you want to
І потім ви робите таким чином.
this here. It goes here and it goes underneath and around the armpit.
Під паху робите,
Here, and then
шию, і сюди, під паху є.
and then it goes back like this.
Так,
So
і ось так.
each time when you're
That is
putting
exactly
pressure,
what I wanted to see.
yeah,
Just
put the pressure there and then just continue
і
to wrap.
затискаєте,
Continue to wrap around and make sure it's tight.
продовжуєте
Like,
і
make sure it's
запевнюєтеся,
very
що
tight
воно,
and
що
cupped
воно дуже
each time.
тісне
And then
кожного разу.
then you just hook it back here. The same applies for an injury on this side of the neck.
Ага, і так само, якщо і з іншого боку, і запевнюєте.
Yeah, so that's how you would pack that. You want to go around the arm on the
Так, і
opposite
потім
side
ви
of the neck.
зачіпляєте тим
І
гачечком.
таз тепер, що дуже
Так, and now the pelvic.
Okay, so the pelvic girdle,
Yes.
that is,
By the way, I'm sorry, what is that?
that's a part of a tourniquet. It's,
Це
I can,
частина турнікету.
Yeah,
They were
I can
getting
show that to
different
you.
ideas.
I can show that to you. It's just a different type of tourniquet.
Yeah.
Okay, so when you're addressing an issue with the pelvic girdle, some signs to look for to
Які
identify
це
that.
знаки, коли ви тазове
Go ahead and
маєте
lay back
поранення?
If,
Значить,
if they have a broken pelvis,
якщо є
you'll
зламаний
notice
таз,
that their feet will be like normally. This is how his feet are laying normally. His feet will
дивитися
be,
за ногами. Якщо
probably be
зламаний
like
таз,
that.
отак
They'll be
ноги
out far to
будуть
the
в такій,
side.
такій
Or some people
позиції.
have their feet like that. If
А
their
інші-
feet are splayed apart like that, very far,
В одних людей
then
по-різному в різних
that
людей.
indicates that he has damaged his pelvic girdle here.
Якщо пошкоджена,
The
тазова
best thing you can do
частина.
in that situation is to not move the casualty. Like
Не
unless you
рухати.
absolutely have to, unless their life is in immediate danger, don't move them.
не рухати.
The more you move them,
Чим більше рухаєте,
the more chance they have of bleeding. And
тим більше буде шансів кровотечі.
a bleed, the way our arteries run is the femoral artery runs right inside the pelvic girdle. So
Всередині буде
the more you move them, it would be like putting like a bag of meat with a bunch of glass.
Чим більше ви рухаєте, то будете
So it's
як
very important to minimize the movement in that time. What you can do, and what the preferred method is
що ви
to,
можете зробити.
you do want to bring their legs together gently, like so.
Легесенько
You want
наближайте ноги
to keep
разом,
them like that.
тримайте їх в такій
You'll actually
позиції.
wrap their legs.
Можете зв'язати
You can
ноги,
use a tourniquet for this.
можете турнікет навіть для
To
цього
wrap it around, that's another
використовувати.
thing. You want to wrap like here where the legs are and here on the
Можете в
meaty
двох
parts,
місцях, тут
not on
і
the
там
joints,
вище,
because
але
it doesn't
не в
create as much
колінах.
stability. So you'll
Отут
wrap, you
внизу,
would wrap a tourniquet
де
around
щиколотка, і там
and
вище
around
коліна.
here, and then you would not move the casualty at this point.
Але не рухайте,
You
бо
want to
кожного
get a
разу.
spine board like what they had before. So the way they moved Cameron on the spine board was they lifted him up and then they rolled him back over, kind of like we demonstrated a moment ago.
Можете підняти чуть-чуть.
With this method, the best way to get a casualty onto a spine board, I don't have a board here to really
Немає
demonstrate it
дошки,
on.
щоб показати.
What it's going to be like here is it's going to be like a two-man pull or carry.
Двоє людей.
So basically, one man is going to be on this side.
Один так, а другий,
One man is going to be here.
а другий
Grabbing his belt
звідси.
loop.
І
You will have the spine board placed at the base of the
і
casualty's shoulders.
під спину дошку підкладайте,
And you'll-
щоб якнайменше рухати так,
And
щоб
essentially,
максимально не
once his legs are
не рухати.
secured, you're basically
Чим
just
більше
going
ви
to,
рухаєте
we're
ту
not going to
частину,
actually
це
move,
якби
you're just going to like pick him up, like just barely
Спричиняє
off the ground,
кровотечу
and you'll
всередині.
slide him,
і ви
onto the
затягуєте,
board.
що
Like that.
якнайменше.
So that lateral movement is going to protect the pelvis from
Це
moving around
захищає
so
таз,
much.
щоб від
Once they're on the board, you'll secure them, but you want to be very careful about putting any pressure on the pelvic area. You want to secure them on their knees and their chest.
забезпечуєте,
А якщо
забезпечуєте.
поранення в паховій області, як
Well,
накладати туди
if
бандаж?
wounded in the here in the the
In
private part,
the pelvic
yes,
region,
yeah,
like
yes,
a wound,
yes.
that is the same as packing the wound with the neck. You pack it
Ага, то там
and you
так
put an
само ви
abdominal and you put a
запаковуєте,
pressure dressing on it.
закриваєте рани.
So
Як
yeah, you would.
put the bandage around.
Okay, yeah, that's a good.
Yes.
How
that
to
is
wrap.
something.
Yeah.
So what you want to do is actually, if you, where did that tourniquet go?
Де турнікет?
The fabric. Okay. Yeah, here we go. Here we go. All right. Will you stand up? We're gonna. Well, here. I'll let you do it on me since you don't have
А
belts
тут і
on.
жовта штучка якраз є,
It's
як
all
тим
good.
робити.
You remember how we showed us to do that in that class? Okay. Do it. Here.
То може звичайний
Yeah.
тапки,
So-
турніки зробити.
Yeah, it was like cinching down the knot with the belt. I forgot. So with your bandage, let's see, it requires the bandage as well. What you want to do is you'll take this portion of a tourniquet. You can use a belt or any kind
Можете
of
ремінь
rope.
використовувати або оце.
If the wound is here on this side and it's very high up, you're going to place this
Ставити тут, це,
through the side of the belt.
через ремінь
You're going to let it
перетягнете,
hang down.
щоб воно висіло.
And when you, I think I got it actually. And when you put the wound, like when you're gonna pack the wound, you'll apply the pressure dressing. Make sure that this portion, will you hold that up for me? Make sure that this portion
Ця
of
частинка
the
має
bandage
бути
is
внизу.
underneath it. Once you finish your wrap, like you get it as high up as you can.
Ви затягуєте так, якнайвище.
Just do it. Just tuck it in. Yeah. And then so he's going to
А тепер,
tie it,
і тепер
and
зав'язуєте.
you're gonna wrench it up on the belt.
Ага,
So
і
it
тепер
creates
підв'язуєте
additional pressure
до
on the
ременя.
interior
І
of the
це
leg.
тиск,
Right, tight.
там
Tie it
притискає
with
найнижче
as tight as
ніж.
you can with an overhand knot and double knot
І
it.
зав'язуєте на два
Like that.
вузли, і
Okay, that creates more pressure than you would get
І
if it
то
was just wrapped.
притискає ще більше, ніж ви можете так просто ручним способом, рукою.
And we should write down the time.
Not for this.
Ми
for
нам
the
слід
tourniquet-
записувати не для це.
For the tourniquet, you put the time
Записувати
down.
не треба.
Yeah, the
Тільки для
tourniquet, you put the
турнікету, там,
time,
що на руці.
put the
No,
time
no.
on the
Це
tourniquet.
теж
And,
турнікет?
but most importantly, you want to put the T on the forehead. So that even like you saw earlier,
Записуйте на чолі, коли на кінці
we wrapped up Cameron.
зав'язуєте.
That is, generally that's how you would be, like you would give a casualty to another medical provider. They'd be wrapped like that.
Тобто тоді, коли
So if their arms are wrapped,
інших
they're not going to
медиків
immediately see
доставляєте
that they have a
рано.
tourniquet. So that's why you put the T
Тоді вони
on
бачать
their head.
час, коли
And
накладений
if you can, just write the time.
Вони можуть не побачити турнікет, але будуть ті побачити. Будуть
Okay,
знати,
yeah,
що
we'll
там
show you
щось
this. So this
Як це
is,
жовтий турнікет працює?
yeah, this is a different type of tourniquet. So as you can see, this is a very old tourniquet, or it's like a basic tourniquet. It's nothing more than a
То
wrap.
основний такий
So it's just a wrap.
старий
This can
турнікет.
also be used as a tourniquet, and then so many things can be used as a tourniquet. So
Багато
basically,
речей можна використовувати
you
як
want to roll
турнікет.
this so that it's about 2 inches. It should be
Складаєте
bigger than your 2
приблизно
fingers, like that.
два
You're gonna roll
пальці.
it.
Має бути більше за 2 пальці.
Так, так.
Once you do that, you're gonna take what's called your windlass. You're gonna go 3/4 of the way up, so that's half.
Ось таким чином
3/4.
складаєте, третинку
You'll
берете,
tie it
зав'єте.
here, and just a normal one knot is fine.
Один вузол робите.
So that's that. That creates your the place where you're gonna twist it.
Ага, і
So-
то ви таким чином ви
Yeah.
можете закручувати той турнікет.
Once you apply this, it's
Закрутка.
simple. It's the same as the other tourniquet.
А далі все просто
just
як
that.
і інші. Ось таким
You get
чином
it
ви
all the way around the leg, tie it
накладаєте, зав'язуєте щільно
Tie it
на
tight.
2 вузли,
with a double knot. Just a
на 2
simple
вузли,
double
і
knot.
тут
And then
закручуєте.
you'll twist
Скільки можете,
like so, or twist like
або в
this.
один, або в
Yeah.
другий бік.
And then once you get it twisted,
А, і як тільки ви закрутили, і ось таким чином ви
it
підпихаєте.
sticks in
і
like
туди.
that, so it holds. Yeah, and so when you apply a tourniquet, when you actually apply one, you should not be able to fit a finger underneath it.
Ага, якби
That is-
накладете, ви
that is the
не
level of
найкращий
tightness.
спосіб, коли
Yeah.
ви не можете туди палець.
So, like this one, I'm not gonna fully put a tourniquet on myself right now because it hurts.
Так, ну то були є, можу запхати, бо мені
So,
боляче, а
so
вам
yeah, and
так треба
also
тісно
one thing.
закручувати.
Where was that pocket card?
Карт.
Is that the card over here? One second.
Чи якась картка була, ні?
Maybe it's something. Oh no, it's
Можна гаєчний
like a
ключ
small
використовувати.
Важкий.
but okay, so
I have seen this
Менше.
inside pocket.
yeah, I thought I saw this too. All right, so with the tourniquet like this, because you're twisting this right here, you can see like my pants are caught in that knot. And that could very easily be someone's skin. It's very painful.
Ага, то може і
So
шкіру
you can
просто
take like a piece of strong
защемити шкіру, тому ви берете кусочок
paper and place it underneath here,
паперу.
like where it turns, so that way it doesn't pinch the
І
skin.
щоб не защепити шкіру,
Yeah.
не зачепити її, щоб то не боліло, бо
Okay,
дуже
cool.
болюче, і таким чином
All tracking?
зробити.
All right, cool.
Кусочок паперу підкласти, тільки такого впродовж. Шкіра, ну та болить, і буде кричати. Ну він попередньо розказував ще перший, коли навіть як кричить, як закриваєте турнікет, що навіть як людина кричить, і ще то все одно звертає увагу.
Should we disinfect disinfect wound on injured people?
Дезінфікувати
Yeah.
рану.
So if you do come across a wound, you can use things to disinfect it. You can use if you have alcohol, like
Якщо маєте
actual
алкоголь,
medical
слід
alcohol.
дезінфікувати.
So before using this one,
Yeah, so
for
you
example.
if you have the opportunity to clean the wound out, you'd want to
Якщо
do that.
маєте нагоду,
so
очистити рану,
on
тоді
my kit-
дезінфікувати власне.
On my kit, what I have is it's just it's called a Camelback. It's like a water pouch. You know
Ну,
what that is? It's
є
like one
такі
that you suck on.
водяні в них набори, водички.
I'll show you really quick.
А може якийсь дезінфектор є.
Ну, а цього не треба намочувати, наприклад, в смерть якийсь ще якийсь
Якщо а навіть нічого не робиш, а потім антибіотики допустити. Ви не будете просто думати, там 60 секунд, що ви якщо симова артерія, 60 секунд,
Ну, але якщо є час, то можна дезінфікувати.
Ну, вони пояснюють, коли з поля бою виносиш, дивишся, можеш
On
стріляти.
my
можеш
kit,
не
I
стріляти.
have like this is like a water pouch. The pouch is in the
Оце
back.
вода, так,
What you
кишенька
can
з
do
водою.
is if you have that, if you have a kit like that and I'm working on someone, you can just
І оце є
spray it
водичка,
like
можете
that. You can put some pressure on the pack and then
Змити.
spray it on the wound to just clean it out. That's okay to do. Yeah. If you have the opportunity to
Якщо
clean the
маєте
wound,
нагоду,
then
то-
you want to do it.
Так, тоді робіть. А якщо ні, то ні.
У нас такого немає.
There is only 60 seconds, so we shouldn't think about that. About cleansing the wound.
Yeah. So the cleaning of the wound is less important
Це менш важливо
because
очищення рани
at least at this level,
на
because
цьому рівні, тому
our
що
job is to keep them alive long enough to get them to the
наша
hospital.
справа якнайдовше
And
живим.
as the doctors can tell you, when they get to the hospital, they're going to get pumped full of antibiotics, and that's going to help with infection.
Так, в лікарні лікарі вже і антибіотики, і все те, що
So,
можливе для
If you can do it,
боротьби з
yes,
інфекцією.
good.
Should we wet this in alcohol?
No.
No.
So, well,
Це не слід змочувати.
typically these are supposed to be sterile. So, like,
Це має бути стерильне.
yeah. So these, you can see they're vacuum sealed. They're
Вони
sterilized. This is the same thing.
вакуумні, це стерильне.
So,
Так.
if you,
Якщо
yeah,
ми
don't when you get
відкриваємо,
these medical supplies, just don't open the package. That way, you know that they're sterile. So that way, you rip it open and you got the
і
same
тільки
thing.
ви відкриваєте, ви його використовуєте.
Yeah, I wouldn't
Якщо він
worry about
відкритий, то й пакунок, то
sterilizing
ясно,
that.
що це не стерильне.
It's basically designed to stop the bleeding. It's going to come out later anyways when they do surgery.
Це не потрібно намочувати,
не
потрібно лише
можна.
затискати рану цим. Можна дезінфікувати, якщо є час і можливість дезінфікувати, якщо є алкоголь. Okay, thank you.
Yeah, cool.
And one more question I had about, 1 second. If something is broken, leg or
Якщо щось
hand,
зламане,
we
fractured.
also can put
нога
our
зламана.
injured person from the battlefield. We can use another hand or something, so we can put them without touching. Or we also can touch
Чи нам
broken
слід-
leg.
Oh,
Чи нам
okay.
слід
So-
рухати ту поранену кінцівку переламану?
The rule with anything that is broken is the same rule like with the broken pelvis.
Те саме правило, що торкається, що відносно тазової частини, коли
The less you move it, the better. So
Чим менше рухаєте,
I
тим
I don't
краще.
have any material here to teach you guys how to splint, but actually I do have some. Hang on.
Якщо зламана рука, можна накласти шину,
So-
наприклад.
well, you can have, you
Питання
can put
полягає
on
в тому, чи
splintage.
можна рухати
Yeah,
If you had a hand.
кінцівку, якщо
So this is a triangle bandage. We'll break that out.
Можливо, швидше потрібно витягти людину, чи можна рухати поламані кінцівки?
So if they have a broken arm, this is called a triangle bandage. Like this is specifically designed for broken arms.
Це є для зламаної руки.
I haven't
Для
done this.
переломів руки. Це спеціально
And it
сконструйоване.
even comes with instructions. It's great. So basically, you want to tie, is that the top end? No. These two ends here together.
Ви зв'язуєте ці два кінці разом.
This is going to go over your patient's shoulder
Це буде йти на плече.
with this end facing out. So if this was my broken arm,
Це
we want
зламана
to
рука.
go over.
І ви ось таким чином натягуєте
And,
і
no,
робите
that's not
такий
right.
слід.
Sorry. Over the opposite shoulder.
Ага.
Okay. So that their arm can stay there. And so
Uh-huh.
this
You
isn't
found
done
it.
right, like what you would do. I did it wrong. So you just want to, so that the pressure from their arm is on their shoulder, and you would adjust the knot here in the back. So that's what you can do for a broken arm. It basically
Вузол
just,
там,
it
на
keeps it
шиї.
from moving, and that saves it from more damage.
Так, і це заощаджує руку.
With broken legs, it's a little bit
А
different.
зламаною ногою
You can use things like this
можете
and
теж таке схоже
like the
використовувати.
tourniquet here to actually tie splints. So that's why it's useful to have these around as well. When you tie a splint,
Можете зв'язувати. це
so
дуже-
let's see. When you're splinting broken legs, the easiest thing to do
Якщо шинуєте
you have a
зламану
broken
ногу,
leg,
то накладаєте шини.
is you're just going to splint it to the other leg because you've got a stable leg here.
Прив'язати до
Ви
іншої
можете
ноги.
так,
This leg.
ви
So you would just tie, like you would just tie these together. If this leg is broken,
якщо ця нога зламана, так,
then you want
прив'язуєте одну до
to tie
другої.
these together here
І зв'язуєте
just to
обидві.
keep them straight. It's not about making a bunch of pressure. Like you don't want to wrench the
Без
legs in
тиску,
together.
так сильно не треба,
But you just
але
you want to make sure that you've got it tight so that
Запевнюєтеся, що тісно,
it
ви
makes it harder for this leg
одна до другої.
that would be broken to move.
Якщо там
So that's the easier way to splint legs.
це найлегший спосіб, як шинувати.
Якщо йому щось доведеться краще одну, все ж таки ногу зв'язати.
If you're splinting a single leg, you
Якщо
can
ви
use,
шинуєте одну ногу,
this is what's called a SAM splint. It's unlikely that anybody here would have these, even they're
вони
uncommon.
мають отаку штуку.
But basically, all you
У нас,
need is,
напевно, таких
you
немає.
need a board, a stick, a piece of wood, something
Все, що треба паличку.
that is straight and strong, and you apply it to
І ви прикладаєте її
wherever the
до...
break.
Inner side?
It can be inner or outer. Technically,
Можна із
it's
середини, можна
actually
із
supposed to
зовні.
be for legs. It's going to be on both sides.
Може бути на
Legs
обох
and arms,
сторонах.
yeah. So it's going to be on both sides. So both sides like this. I just don't have two.
Yes, we are to put a piece of plank of
Yeah,
that.
yeah.
Можете кусочок,
Same thing.
кусочок
Yeah, this
якоїсь
is just
планки взяти з одного
This is a
боку.
fancy plank.
Прив'язати.
That's it. So you do that, and wherever the break is, it's important to know. If my break on my leg was here, and you can tell, you can usually tell by swelling being more in a certain area.
Сказати, коли там напухає, ви бачите.
You want to do
Де є?
at least 2 to 4 inches above
Вище.
above the
Вище
suspected
два.
break,
Десь
and then
кілька
the same thing,
сантиметрів
2 to 4
вище.
inches below the break, and then you tie it straight. Now these can be tight. You don't want them to lose circulation. They don't have to be super tight, but they do need to
Не
be.
треба дуже сильно,
They
так
need to
щоб
be secure.
просто
Yeah.
щоб зафіксувати це,
So-
але не дуже сильно, щоб циркуляція продовжувалася.
Yeah, so that's splinting.
Шина така. Все.
And if injured person lost conscious,
Якщо людина
how
втратила
you can
свідомість,
return him to consciousness?
Typically, you can't. There are some ways to
Не
do it.
можна.
Not, yeah.
And if should we do this when
No.
Чи нам слід
No.
виводити людини, приводити її до тями?
There are some ways to do that. They have
Є кілька способів
like
це
they
робити.
call them smelling salts. And they're very strong
Вони мають
smelling
солі,
salts, basically that just like make people wake up. You can do that, but it really wouldn't be during this level of care. That's more for like if you have it available, you can do it. But like
Якщо ви маєте щось доступне, щоб
getting them conscious again is not super. It's not as important as just
це не
all the
таке
other stuff
важливе,
that we
як
covered because you can still do
берегти
everything.
життя, і ви
And in fact, it might be better if they are unconscious, especially if
може і
they
краще,
are
що вони без свідомості, а
wounded
їх
severely, because the psychological effect of realizing that they're wounded so much can
І не
make the
усвідомлюєш,
situation
що така
harder for
рана.
you to provide them aid, and it can also
і
affect their
краще
body
його в
chemistry.
такому стані.
І ще одне, я от дивлюся на цю штуку, вона зрізана з цю сторону. Якщо кажуть до середини, праву частину,
Так,
то
вершочок цей
Бажано,
гострий,
щоб воно
ні,
було отак?
ні, вершок має бути.
Так.
Отим
ні,
гострий
казали
той вгорі.
зрізаним тим
Ви так
кінчиком до
бачите.
середини.
Так, так.
Але ні, отак. Отак.
Отак.
Так.
Все, зрозуміло. Бо казали до середини.
А як розрізнити, що є в людини якісь внутрішні кровотечі, наприклад?
So how to, what are the signs of inside hemorrhage?
Of signs of
How to, well, symptoms of inside
internal hemorrhage.
Internal hemorrhage.
You probably won't see them.
Напевно, ви то не побачите, немає.
It's very hard to tell, but by the time you'll see severe bruising. Typically, it's going to be in the pelvic area, the pelvic and lower abdomen area.
Синяк, тобто синіння, так, гематоми сильні.
Yeah, it's going to be like severe bruising and swelling, like and swelling. So if you see their stomach swelling, like their abdomen swelling or their
Так ніби
chest
живіт
swelling in a
набрякає.
really strange way, that
Дивним
is a sign.
способом таким чином.
Unfortunately, there's really nothing you can do about that.
На жаль, нема щось такого, що ви
In
могли
first aid and
зробити.
battlefield medicine,
Нема ліків.
there's nothing you can do. But basically, that means that they've got an artery that's been broken loose somewhere in their thoracic cavity, or also it can be the femoral artery that has
Може
shot
бути
back
якась
up into the
артерія,
pelvic girdle if it's been severed.
ушкоджена.
However,
тому ви нічого не можете.
Yeah, there's not a lot you can really do at this level of care. There's not a lot you can do. That requires
На полі бою ви не можете багато чого
immediate
зробити.
surgery to fix that.
Okay, maybe you know how much time we have when we have some wounds inside. How much time we have?
Hemorrhage, якщо кровотеча всередині,
it
how much
depends.
time to...
You can bleed out in about 5 minutes. If you have a fully severed artery in your thoracic cavity, you can bleed out in about 5 minutes if it's fully done.
Якщо в грудній частині, то 5 хвилин.
Yeah, so
Приблизно 5 хвилин в грудній клітині.
honestly, and to be realistic, from what I've seen and in my experience, by the time you realize the signs of it, it's very likely they've already lost consciousness or they're too far gone to recover. It's unfortunate, but yeah,
Але
that's a bad
транспортувати
one.
пацієнта, який має, наприклад, внутрішню підозру на внутрішню кровотечу, яким чином? Його можна на плече закинути, чи його треба на дошці транспортувати нерухомо?
Internal hemorrhage out of transport. How fast?
How much time?
Тобто немає значення. Нам треба максимально швидко довести людину до...
It doesn't matter how fast.
No,
Щоб не нашкодити.
you want to transport the patient as fast as possible. Like, but realistically, even if an injury like that occurred at a hospital, it would still be maybe 50-50, like 50% chance that that person would survive. Because it takes severe, like, you'd have to be on the surgery table with a wound like that within a matter of, like, literally 30 seconds to a minute. Yeah, it's bad. There's really not, unfortunately, there's not a lot we can do. Not with the medical equipment that we have here. So, like, sometimes in the U.S. they have ambulances that have some ways to fix that, to like prevent it long enough. But here I'm not sure about. I don't know. I haven't been a medic here, so I don't know what they have. I would hope that they could do something about it, but that is not.
Надіюся, що медики в Америці щось мають таке, щоб запобігти тому.
Чим вони закривають відкриті рани черевної порожнини?
So if there are open wounds in abdomen cavity, well, how to cover, how to close,
Чим закривають?
what to use
Like evisceration?
to plug.
Evisceration. Okay. So basically what you want to do is if they have evisceration, if their guts are hanging out, their intestines are hanging out, you want to clean it, because that is one of the things you want to do. Clean it and also keep it wet, because you'll apply. They have specific dressings that are designed for the abdomen. They're very large. Essentially, you don't want to push their guts back in. You just want to like kind of hold them there. So you'll clean it. You'll apply an abdominal dressing, and you'll continue to make sure that it's moist, because if your bowels dry out, like if your intestines dry, you'll lose function of them, and it's almost irreparable within about 10 minutes if it's totally dry.
Якщо буде пов'язка сухою, якщо буде, тобто потрібно підтримувати вологість пов'язки для того, щоб органи не втратили життєдіяльність.
Чи можна просто клейонка чи щось?
What materials could we use?
So you could use cloth. You could use a shirt or a jacket. It's not the best. Something you could use would be polyethylene. Yeah, you could use plastic wrap. Just film. Yeah, you could use plastic wrap as well. If you have to improvise, you could. Yeah.
But keep it moist.
Yeah, try to keep. That's the problem with the waterproof stuff, is you can't keep it moist. It might maintain the moisture, but if you have to use it, it's better than nothing. You know.
Thank you.
Cool. Yeah, of course. Let's see. Saying 14:45.
Ще якісь запитання?
Yeah, thank you.
Any questions?
Yeah. Okay.